A collective of healthcare workers in Singapore has renewed calls for a ban on transporting migrant workers in the back of lorries, following yet another accident that left 5 workers hospitalised. The petition, signed by over 300 healthcare professionals, was submitted on 28 February and directly challenges the government's continued defence of the practice. On 1 March, a lorry carrying migrant workers was involved in an accident with a car at the junction of Punggol East and Punggol Central. 5 male passengers aged between 25 and 45 were taken to the hospital, while 2 others declined medical assistance. The 41-year-old lorry driver was arrested for dangerous driving, and police investigations are ongoing. The petition, organised by the healthcare collective Sick and Tired, was submitted just days before the accident. It directly responded to comments made by Senior Minister of State for Transport Amy Khor in Parliament on 26 February, where she argued that banning lorry transport for workers was impractical due to financial burdens on small and medium-sized enterprises and a shortage of bus drivers. The healthcare workers strongly rejected this position. "We too often see migrant workers in the emergency department, intensive care unit, surgical and orthopedic wards, and sometimes even in mortuaries, as a result of injuries from unsafe lorry transport," the petition stated. Their frustration was further fueled by recent cases, including the death of 40-year-old Shohog Mohammed in December 2024. He was killed in a lorry accident, leaving behind a 6-year-old daughter. With the latest incident on 1 March, calls for immediate government intervention have intensified. Between 2011 and 2020, 58 workers died in road accidents involving lorries, and 4,765 others sustained injuries. Rights groups and advocacy organizations have repeatedly called for the government to adopt safer alternatives, such as shared buses and goods-cum-passenger vehicles, which have already been implemented in other countries. The petition also highlighted the financial aspect of the issue, pointing out that in 2020 alone, at least 1.1 billion Singapore dollars was collected in foreign worker levies from industries that rely on lorry transport. Healthcare workers questioned why these funds were not being used to help companies transition to safer alternatives. Public pressure to ban lorry transport has been mounting. In 2023, over 50 community organizations signed a joint statement calling for a ban. More recently, students across Singapore joined the movement, signing a joint statement that emphasized the dangers and lack of dignity in transporting workers in lorries. Despite these efforts, the government has maintained that a full ban would be challenging. Authorities have instead introduced safety measures such as speed limiters and encouraged firms to transition to buses where feasible. However, advocacy groups argue that these steps are insufficient. The healthcare workers' petition ends with a stark warning. How many more workers will be injured while the government continues to have difficult conversations? Migrant workers' lives matter, and their safety must be prioritized over business concerns. With repeated accidents and growing public outcry, the debate over lorry transport for migrant workers is intensifying. Advocates continue to push for urgent action, stressing that further delays could result in more preventable injuries and deaths.